scary stuff, and I'm wanting to apologize because the next few slides aren't going to cheer you up either. This is, I guess you're already convinced that we have a lot of chemicals, but this is sort of the visual representation of it. This is data from BARFIS, it's a great acronym, the Behavioral Risk Factor Study. Every year they poll Americans on their behaviors that are relevant to health. And here it's starting in 1985, and they want to know something about obesity levels. So they took the BMI over 30, 30 pounds overweight for a 5'4" person. So these are obese, not just overweight. And they looked, and there's only a few states reporting. The white states haven't reported at all. The rest of the states are reporting either less than 10% or between 10 and 14% of the population obese in these states in 1985. And this is what happens in 1986. 1987, you get more states filling in. Here, California succumbs to the 10 to 14%. And then we get more information. Here in 1991, unfortunately, they have to introduce a new category, 15 to 19%. Some states are reporting more than 14% obese people, and this is 1991, so this is still, 20 years ago. And as more states continue to report, now there's nobody reporting less than 10% obese, and the dark blue is spreading. 1996, 1997, here comes another new category. Unfortunately, we could not account for these same states right there in that same spot starting to show more than 20% obese. 98, 99, in just a few years, the entire country turns into that 20%. And now we have yet another category, 2001. That's still about 10 years ago. And this has been the progression. You know, Colorado loves to stand out and say that. So Colorado likes to hold out. I don't know if it's the altitude. That's the one explanation that I read. I'm like, what? But it is actually kind of all the states, it's a little bit higher than the other states. So maybe it's the altitude. And you can see how this continues to progress as 2004, 2005. We have yet another category. Some states are reporting more than 30%. And this is where we're at now. Colorado holds out for as long as it can and eventually falls. Yeah, this is last year, 2010. And this is what it looks like. Large swaths of the country with more than 30% obese. And just 25 years ago, we had less than 10% obese in many states. So this is basically not genetics. Human genes do not change this fast. There's no way in 25 years you can have between, that kind of a change. In fact, behavior doesn't account for this either. You can't get people to eat enough fast food in 25 years to make enough of a change to go from 10% to 30% obese. When they look carefully at how much less activity people are getting and how many more calories people are eating, which it's true, they're less active and they're eating more, it's true. But if you add up the calories, it doesn't add up. So that leaves us with some of the issues around cortisol. You're absolutely right about cortisol is really playing a key role here. These hormones have to be made by the body, and they're actually connected to each other. We have one precursor that either makes cortisol or it makes testosterone and estrogen. And so when you get really stressed out, that can sometimes have an impact as well. But the other important thing about cortisol is how it does this insulin resistance thing. The insulin resistance means that the sugar stays up in your bloodstream, and your pancreas doesn't like that and puts out more insulin. But insulin is a storage hormone, so if you put out enough, eventually, first of all, people will eat more because once you put out enough insulin, eventually the sugar drops and they're hungry. But also, so you will end up with weight gain, but we know that overweight causes insulin resistance. So once you start on this, it's hard to get off of this kind of vicious cycle. But we've been arguing that the problem is people eat too much and they get overweight and then they get insulin resistance. But then if there was something that targeted insulin resistance directly and caused insulin resistance directly, then that would get this whole thing started. And I think that that's what's happening. We know some environments, some chemicals in our environment make us fat. It's called the obesogen theory, and now it's becoming more and more popular. We have names for them. BPA, we already talked about. It's hard to stop being exposed to BPA. A lot of it is in receipts. Can't touch those receipts. I was amazed, actually. I went in Boulder this past summer, and whatever store you go to, I guess maybe that's what Colorado's holding out. Whatever store you go to, they ask you, do you want your receipt? And it's the only place I've ever been to where they actually ask you that. We don't want to touch that stuff. And I don't know about the poor people selling the stuff, but we don't want to touch it. Cheaper metal bottles still do have BPA. If you bought your SIG bottle, you're kind of good. It's not BPA in there. It's something else, which we don't know what. But the cheap metal bottles that they sell at some of the discount stores still have BPA. Now we have TB-BPA. It's our major flame retardant now that they've outlawed the others. And that one directly impacts your thyroid, where Michelle was talking about TRH, the thyrotropin releasing factor, which is way up in the hypothalamus. TB-BPA actually has an action up there. TBT is an antifungal that they use in wood products, but they also put it in your pillows, especially anti-allergenic pillows, so that they don't grow mold. These things bioaccumulate. They don't break down in the environment. They don't break down in your body, so it makes complete sense that over time, the levels rise and rise and rise, and you get more and more. So, I mean, yes, we're eating more fast food as a nation, but these levels are rising as well, and it makes sense because they are persistent. That's the name for them. They're released from fat stores during weight loss is one of the reasons why people hit a plateau when they're trying to lose weight. They interfere with thyroid hormone, so they change the communication in the brain. Some of them might even convince you to not exercise. Stay seated. That's the level at which they act. We have diabetogens. There was a study that really blew me away and got me thinking differently about things. This is actually part of BARFUS as well. They took 2,000 people and they measured the levels of pollutants in their blood. So then they had ranking from the lowest to the highest. They divided them into 5 groups. The people in the highest quintile, the 20% who had the most pollutants in their body, had a diabetes risk which was 40 times as high as the people who had the lowest amount of chemical in their body. So, I mean, how many ho-hos and how much fast food do you have to eat, really, to have 40 times more of a risk of diabetes? We don't get those sorts of ratios in medicine. We're excited when we have like a doubling, of risk. That's like, wow, that's really that's carcinogenic. It's like twice as likely to cause cancer. 40 times means all of it. And I try to joke with people and say, if someone shot you in the head, you wouldn't have a 40-time risk of dying. It's that much to me, it's that much of a level. It's like 40 times. I mean, that's almost all the diabetics are in that category then. So we need to look at that more. Not that you should go out and eat fast food because of the detoxification, which I'll talk about in a minute. Obscure hormones. So when I was doing this research, I really tried to educate myself about all these hormones that they had not invented yet when I was in medical school. So leptin was one of them. I don't remember when it was found, but so leptin decreases appetite. So we want that, right? And it works against, the way it works has now been found. And what's interesting about all these words, neuropeptide Y, anandamide, alpha MSH, these are all obscure. They're not familiar, really, to a lot of doctors out there. They were not invented. They were not found when we were in medical school. So leptin will work through activating thyroid hormone. Leptin is made by fat cells. But the more fat cells you have, the less leptin they make. Adiponectin is another one of these obscure hormones, also made by fat cells. This one protects you from diabetes, obesity, and heart disease, atherosclerosis. And fat cells make it, but fat cells make more to protect you when you're not fat. So here we have these mechanisms that are really hard to wrap your head around, and it's not doing what you think it's going to do. And then one of the interesting things that I read about adiponectin is that there's an herb that's used by naturopaths to heal the gastrointestinal system, and also to fight bad bacteria in the gastrointestinal system. And this herb, berberine, has a positive effect on adiponectin. So I don't know how that's connected, but I think it's interesting that some of these herbs are doing things that are hard to do in other ways. And then ghrelin. Ghrelin is made by the stomach, not the fat cells. This one stimulates appetite, but it also does some cool things. It helps with learning. It defends against depression. It protects your intestines. People with gastric bypass have their ghrelin levels fall. And that is good because then they don't have so much appetite, but it's bad because then they have a higher risk of certain things. Specifically, the risk of Parkinson's disease has been shown to be higher in people with lower levels of ghrelin. And I don't know if they've studied people with, I couldn't find a study that linking gastric bypass to Parkinson's disease, but that's a possibility. And again, it was discovered just a few years ago, so how many more is there? And to me, you know, how can we test all the chemicals out there for effects that on hormones that we don't even know exist? These things are keep finding new ones. So this is my all-purpose approach. So first we're going to crash the economy, buy and use less stuff. Just don't. I mean, we don't even know what's out there and what, so just have less of it around. A HEPA filter could be useful. It says frequent vacuuming, and I don't know, that means a couple times a week for me, which is for anybody else. Buy organic, so maybe cotton too, because that's full of a lot of chemicals. Eat your veggies, like Morgan was talking about, definitely the broccoli family, that entire cruciferous family is awesome for balancing hormones, and it also helps with detoxification. That's also good because they're dark green leafy vegetable and they have tons of phytonutrients. So they're fighting the oxidative stress that was in Michelle's slide about the thyroid. Yeah, so all the dark green leafy vegetables, they're kind of, I guess they do cleanup. They help after your body's been fighting against chemicals and it's been fighting against germs and it's been falling apart and rebuilding itself. They help with cleanup, so they're really very important to have. Yoga, exercise, meditation is where you tell your body to get that cortisol down because it's not doing you any favors when it gets up to a certain level. There's no reason to have it at that level. And work with us because, first of all, we go to the state level and we try to make different changes in the policies, the pesticide policies of the state. And because California is a leader in environmental issues, then the country starts looking at what we do to try and see if they can get support for lowering pesticides as well. And also because we have fun. We talk about all this stuff and eventually it's not so terrifying when you look at it enough.